Hello, and welcome to this episode of Great Conversation. I'm very lucky to be here today with Karen Gilroy. She is the program director for the Center for Wound Healing at Ocean University Medical Center. And I'm excited to talk with you today and learn a little bit about what it is that you do. So what is a wound healing center?
So a wound healing center, we specialize in healing difficult to treat wounds.
Okay.
So one of our challenges is some wounds, for whatever reason, have difficulty healing, impacts the quality of life, impacts other bodily functions and the health of a person all over. So we look for those wounds and see what we can do to treat them with our arsenal of supplies and our panel of expert physicians.
Okay, so what would be like an example of a wound that wouldn't heal? I mean, I don't know if you can give an example.
Sure,
but.
I can give I can give a bunch of examples. So it could be a wound that is over 30 days.
Okay.
And it hasn't healed yet. Mm-hmm. It could be a wound that has an infection. Mm-hmm. And even though you're on antibiotics, it's not healing.
Okay.
It could be a wound that has opened and then closed and then opened and then closed, which means there's something else going on underlying that wound. So we need to look at it, find out what that is, and make sure we cross the finish line so it stays healed.
Okay.
For the rest of their lives, hopefully.
Hopefully,
yes,
right?
Hopefully, that would be the goal.
Yeah.
Some of the other is if a wound shows signs of infection. Mm-hmm. So we're looking at a whole bunch of different things. I call my doctors and my nurses detectives because they're not just healing the wound. We're looking at the underlying reason that wound isn't healing. Okay. And that's what we really have to address. Why we're taking care of the symptom, which is that open unhealing wound.
Sure. And these wounds could be anything from if you cut your foot and, it just won't close up, or you bang your... I mean, is it all open wounds, or could it be like if you have a lot of like bad bruising somewhere that just won't...
Typically not bruising unless it's a hematoma that needs drained and opened up and then causes a wound. Okay. There's also internal wounds that we will deal with and treat. Some of those internal wounds are typically caused by what we call the late effects of radiation. Okay. And this can be years and years after you've had cancer, radiation, and sometimes just years later, that damaged area that's kind of been limping along without any problem now breaks down.
Okay, so now I'm curious, because if let's say it's one of those types of wounds, how would you detect that? Is it seen from the outside, or how would you know that?
It's usually symptomatic. They've gone to a urologist. They have gone to a gastroenterologist. Sometimes it's oral surgery. Okay, so if a patient's had in their mouth and they've had radiation, there's damage there. So then the oral surgeon, before they do the extraction, they want hyperbaric oxygen treatment to build up the bone. Okay. So when they do the extraction, the bone's not disintegrating and further harming the damage from the radiation.
Okay, that's super interesting.
So that would be one that we use. That's actually one of our highest indications for hyperbaric oxygen is radiation treatments. Okay,
so what are some of the things that you as investigators that you look for when you're doing this type
I
of
would
work?
say one of the biggest one is diabetes. So if you're a diabetic, sometimes wounds love oxygen. Blood flows to your extremities and it delivers the oxygen to that wound, and then your wound starts healing. So if you're not getting that because you're a diabetic or you have venous insufficiency, that blood isn't making its way down to that lower extremity wound, and that's impacting your healing. So we have to look to see, do you have venous insufficiency? Are you a diabetic? We have diagnosed patients that never had any idea that they had diabetes until they came to the center. Okay. And they come to the center, non-healing wound. What's going on underneath it? Why isn't it healing? We'll do a complete physical and intake to try to figure out why that wound's not healing.
Oh, that's really interesting. And I guess... So with diabetes, just for my information, I realize we're talking about wound healing wounds, but is it because they don't necessarily feel everything in their extremities?
That's a good part of it. Yeah. Okay. Especially when you're underneath your foot. It's something called neuropathy. Sure. And you don't have sensation at the bottom of your foot. I know one of the health fairs I went to, I gave everybody mirrors so they could look at the bottom of their feet. We also talk to patients that once you're healed, when you go to your primary care physician, make sure you're taking your shoes and your socks off. You want
right.
somebody to be looking at the bottom of your feet. You know, a lot of our seniors can't see that.
Yeah.
Sometimes I can't see
Right.
that.
How do you get your foot
How
up
do you
there?
get the foot up there high enough that you can see what's going on underneath it?
Exactly.
So we've handed out mirrors in the past just as an education tool, because once we get that wound healed, we don't want that patient to come back. We want it to stay healed.
And be able to maybe monitor on their own, like, look what's happening down there. Can I see what's going on?
And then if I see what's going on, if I catch it early, boy, that makes a big difference on how quickly and how easily then we can heal that wound.
Okay. So you're located within the hospital.
We are in the hospital.
Okay.
Yes.
And what would somebody do to make an appointment or meet up?
There's a couple different ways. Okay. So you don't need a prescription or referral to come to the center. Okay. But I always also recommend that you have close contact with your primary care physicians. Mm-hmm. Primary care physician has been hopefully your partner in your health for a significant amount of time. I've had mine for, I want to say 15 years. Okay. She knows a lot about me. So if I go to her first, she can direct me into the direction that is possibly the wound care center. Mm-hmm. So we do educate the primary care physicians. We have a marketing campaign and we go out and we go to their offices and we'll bring them things like what to look for. I'll bring them nutrition flyers if they want to say, you know what, if you really need something, nutrition is a huge part of wound healing. Right. So a healthy person really needs a lot of support in order to heal that wound. Yeah. And that's what we're there for.
Now, are you seeing mostly senior citizens? Or are you seeing people of all ages?
We see people of all ages because unfortunately diabetes can start earlier in someone's life. Mm-hmm. So if you're a diabetic, we can really see you at any age. Okay. Typically something like venous insufficiency, we'll see somebody that is more the senior population. Sure. Because of our demographic, of course, here in Brick, we see more seniors, but we do have quite a few younger people just because of, comorbidities and autoimmune diseases and things that they're dealing with otherwise. All those things impact your healing outcome.
Sure. And I would think sometimes younger people may be prone to infection just because maybe they're not cleaning the wounds properly or taking care of it necessarily the way they should, right?
There's a couple of big components in healing the wound, which is challenging to anybody. Sure. It's sitting and keeping those legs elevated. Yeah. If you're
People
busy,
don't do that.
If you're working, to say to them, go sit down and elevate your wounds 50, 60, 70% of your day, that's a challenge. Right. If you're still working, if you're a younger person, we'll do a TCC and try to offload where that wound is getting the pressure. Sometimes that works, but again, sometimes you just have to be off your feet. Right. We also see pressure ulcers in some of our seniors. Again, it's trying to then either with a specialty bed or a RoHo cushion, trying to relieve the pressure that's then causing that wound. Right,
because for some people, it may be not necessarily that you cut yourself or whatever. It could be if you're a senior and you don't get a lot of movement and you're sitting or laying down a good amount of time.
Absolutely.
It could be on your back or on your lower back, any back of your legs, that whole area.
The whole area. Prone. And if you're compromised, I mean, if you're a senior and you're compromised and you're dealing with a lot of health issues, you're not energetic. You're not moving around. Yeah. So that's a huge impact and a huge challenge. So then we'll look at offloading tools and things that we have that we can get for those seniors to try to relieve the pressure in the area that the wound is happening.
Do you see mostly wounds like in the lower extremities that are really struggling to, if people knock their arm, unless there's a hematoma, like you said, it really just kind of heals on its own. Usually,
typically, yep. Yeah. We'll see in the lower extremity is the vast majority of the wounds that we see. And our goal is always limb salvage. So we're always looking at, can we improve the blood flow? That's why I have vascular surgeons on the panel. Vascular surgeons are going to look at that. They're going to test to make sure the flow is getting down to the toes. Right. If they're not, then they can do the surgical intervention right there at the hospital. So it's really a multidisciplinary approach with everything they need within that hospital. That's why it's such an advantage. We can see from head to toe. We have infectious disease on speed dial. Yeah. So if there's an infection, the doctor who's treating the patient will text the infectious disease guy. Within a minute, he's down into the treatment room. And then he's prescribing a specific antibiotic for that wound. Right. So the patient leaves with a prescription for an antibiotic instead of a referral to a doctor. Waiting to go see. So we can eliminate almost 2 weeks of time
That's
and
great.
get that patient started on that specific antibiotic that's been prescribed by an infectious disease doctor. And who better to get that knows nobody knows antibiotics like that.
And that's great. It's like one-stop shopping.
Yes,
basically.
it is one-stop shopping. And even within our panel, if the podiatrist is looking at a patient and says, I think you need vascular, flip over to the vascular doctor. They see the vascular doctor next week. He does his thing and then flips the patient back over to the podiatrist so that we can complete the healing process.
So is it typically, the person comes in, you plan out what's the plan for getting this healed, and then the person would then hopefully come back for rechecks to make sure that it's
typically they come back once a week until that wound is fully healed.
Okay, good.
Because wounds can unfortunately go the other direction very quickly.
Right.
Say a patient isn't supposed to shower, but they do. So the next
they get it wet.
Yeah, they get it wet. So so the next time they come back, then all of a sudden we have an infection that we didn't have the week before.
Right.
And our patients some of them tend to be compromised. Seeing that physician every single week will catch things like a potential stroke, high blood pressure, because every single time they come in, we're checking their overall physical condition. If there's a concern, we have the emergency department right there, and we're sending that patient to the ED just so then they're checked head to toe to make sure that at that point, we're not concerned about the wound. We're concerned about their overall physical condition.
That's fantastic. So is there anything else you want to share that maybe we missed not touching on for this?
I think maybe just a little bit of our hyperbaric oxygen chambers, also known as HBO, not the movie channel. That's what I first thought 13 years ago.
It's probably not as much fun.
No, it's not as much fun. Although the patients usually that go into the HBO sleep through their treatment.
Oh, wonderful.
Yeah, there's a DVD there. I have often volunteered to go in, but they won't let me just because I need the nap and to get away from my cell phone. But they will be in there for 2 hours.
Okay.
There's specific diseases that you're going to look for. It's a very limited criteria that if you have a very severe diabetic ulcer, we're going to look to see if that's appropriate for you. If you have a bone infection, we're going to look to see if that's appropriate for you.
Sounds terribly painful, bone infection.
Yeah, bone infection.
I can't even imagine.
And there's also your late effects of radiation. That's going to be an hyperbaric oxygen or HBO treatment, and necrotizing fasciitis and a few other things, gas gangrene. They started HBO, of course, with the Navy.
Right.
When the divers with the bends, that's where it came from. So it's been around a long, long time. It's a very simple treatment. It's a long treatment. Right. But we've seen some remarkable... So it's
actually a treatment.
It's a treatment. It's a long process, but we've seen a lot of remarkable healing success that we weren't able to heal otherwise.
Oh, that's awesome. Now, if somebody is to do that, could be a it's not a one and done with that necessarily.
No, that's 5 days a week, up to 4 to 6 weeks.
Oh, my goodness.
It's a very, very slow process, but I have had people that see symptoms resolve in a couple of weeks, and they're so excited. They're like, let's keep going.
You get your life back, right?
Yeah, get my life back. Let's keep going. The 6 weeks then doesn't seem like such a commitment when you can see the progress being made while you're doing it.
You start to get out of pain.
Absolutely.
That's wonderful. You have a lot of great things going on.
We do. We're very proud. Like I said, we're 13 years. We've been open in June. I have a lot of the same physicians. I have a great team of nurses that is so into wounds. It's very heartening to see. They get very excited as the patients heal. I have an internal med doctor that's just a pleasure to work with because she just is so excited. Yeah,
it must be gratifying when you can actually see the progress.
Yes. When she walks out of that room and she tells me, that patient's healed, it's a celebration.
That's wonderful. Oh, I really appreciate you coming in and talking about your program.
Yeah.
That's fantastic.
Thank you.
So if you have a wound that will not heal, and you're really struggling with that, I would say you'd be a great person to reach out to.
Yes, absolutely.
If you reach out for the Center for Wound Healing at Ocean University Medical Center, someone there would be really happy to work with you, right?
We have a great team. My clinical nurse manager talks with patients all the time before they've ever stepped in the door.
Well, I can't thank you enough for joining us today.
It was my pleasure. Thank you.
Thank you. Thank you for joining us on today's Great Conversation. And we'll put some information up for you in case you would like to reach out to have a discussion about maybe some wounds that will not heal, or if you know someone who has some wounds that won't heal. Thanks so much and have a great day.
Thank you.
Yeah.